Good afternoon, ladies and gentlemen. Our webinar is beginning. I'm Steve Love, President and CEO of the Dallas-Fort Worth Hospital Council. We want to thank you for participating today in this educational webinar, and it's hosted in coordination with InsMed Insurance Agency, who is an associate member of the Hospital Council. Today, the topic is going to deal with student loan repayment for medical professionals. And since 1993, InsMed Insurance Agency has been guiding and advising healthcare professionals seeking to secure insurance protection where there could be the impact of an accident or illness and impact their financial well-being. Today, we're delighted. We've got Justin Cribbs with us. He's the Director of Financial Planning and Student Loan Services at InsMed, and he'll be the primary speaker. Debt has certainly been the subject of a lot of media attention over the past few years. Today, this webinar is going to focus on the trend of that debt accumulation within the healthcare industry and the different type of loan repayment plans, strategies, and structures employers can use to help address this issue. So we look forward to this presentation. And ladies and gentlemen, it's my pleasure to now turn this over to Justin.
Excellent. Thank you so much for the introduction, Steve. Thank you for being here, everybody. So as Steve said, my name is Justin Cribbs with InsMed Loan Advisory Services, and we're going to be going into a topic that, of course, comes up a lot, and that is debt, especially in, after this last election, and how there's been a lot of media attention, especially when paid attention to possible forgiveness, possible discharge, congressional actions, and then how that might actually change the landscape. So without further ado, here's our agenda for today. Won't dabble on this too long, but we're going to get into how the debt's been accumulating and some of the various congressional actions that have taken place, and also where we're at with public service loan forgiveness and what the different repayment options are out there. So what's interesting to me is that I've been dealing with debt, especially with the medical community, since 2012 when I worked at Oregon Health and Science University. And I was hired as a financial planner there. And one thing I would always look for is data on, where's everyone at? How, what's the debt looking like? Where is it going? How's it accumulating? And one thing I found out was that there only one organization actually tracks debt numbers. That's the WAMC. The APA, the American Dental Association, the pharmacy associations, no one really has a number that shows how all the different medical professionals are accumulating debt. We know that they are accumulating debt. We just don't know what those numbers look like. And every profession looks different than the next, as you can imagine. Whereas you have the WAMC has been very good, especially when you look at the GQ that they make every medical student complete when they leave. They have that data that they're always gathering, but none of these other organizations are actually looking at the debt as they're exiting out from a program. So I'm always asked by people, which profession has the best outlook? And I always tell them, well, it really depends on what the data is going to say. We don't have a lot of data other than the WAMC. We have some federal data. Federal data is what they talk about a lot now. We have, 1.2 trillion in federal direct loans. We have 124 billion in private loans, and we don't have any of the other data that comes down to, okay, institutional loans, bank loans, family loans, third-party loans. One thing I learned when I was at OHSU is how creative families can be at paying for a medical education. And then also this data, once a person refinances a loan with, say, with like SoFi, Laurel Road, Evervest, that number isn't taken out of the equation, so that educational debt is still out there. It's just not counted as educational debt. For instance, First Republic Bank, their refinance program isn't structured as an educational loan, it's structured as a personal loan. So then those people who have refinanced with somebody like First Republic Bank, those numbers are no longer part of this national conversation because that debt has been removed. Now, when they talk about the accumulation of the debt, we're at the tip of the iceberg in terms of what we really have outstanding nationally. Looking at where we've come from back in 2007 to where we are today, it just shows that there isn't really any sort of slowing down of this trend. And when people think about loan repayment, they always think about it as somebody else's issue. And this is one thing that I have also discovered, is that it's a multi-generational issue. Not only do I have the student borrowers who have the loans, but I also have their parents who will have loans, and in some cases, the grandparents who also borrowed. So you might have the grandparents that borrowed a Parent Plus loan to pay for their grandson or granddaughter's education to undergraduate. And then you might have had parents that helped them as they went through graduate school. So then you have 3 generations that have debt. And then, the ACOM just came out and today and said that they've seen an 18% increase in applications for osteopathic medical school. So we know that people are going to continue to go to school. The debt trends are not going to turn around anytime soon. When we look at the medical community, the average debt according to the WAMC is well over $200,000. There is a larger number of people graduating with $200,000 or more in debt. The trend has been going up, and now it's above 50%. So over 50% of medical students graduate, excuse me, graduate with over $200,000 in medical school debt. And also, when you look at who is chasing things like public service loan forgiveness, NHSC students to service, NHSC state funded repayments, we had in Oregon, we had SHOE, Scholars for Health Oregon initiative, all these different states that have their different repayment opportunities that are out there. You see a greater number of graduates also saying, hey, we want to take part in these programs. So as the debt is increasing, more and more individuals are looking for help, third-party assistance to help pay off their loans. And this is something that I see a lot when I'm counseling, let's say, a resident that is negotiating their very first employment contract. They're looking at which employers are going to offer them repayment assistance. And you'd be surprised the number of employers, and maybe you might not be surprised at all, but the number of employers that are actually offering assistance, I see a lot more assistance than I see employers not offering that assistance. For instance, you might have a lot of employers that will say, hey, yeah, you come work for us, we'll give you $100,000 towards your debt as long as you stay on for 5 years. And those I see as being a lot more effective than the programs that some schools roll out, where they say, hey, we'll pay for your medical education as long as you come back and work in our state. Well, I'm dealing with an individual right now who they received a scholarship to attend Oregon Health and Science University for medical school, as long as they came back and worked in Oregon for 5 years after they graduated. Well, they're finishing up their residency right now, and they want to stay where they're at, and they're not in Oregon. So those programs where they're trying to ease the debt burden by providing providing scholarship assistance, those are actually backfiring in some cases, because you have these residents that, hey, you talked to me as a medical student, of course it sounded great, but now as a resident, I've been in practice a little bit longer, and I like it where I'm at now more than I liked it when I was back in Oregon. And so we're going to see a lot of changing trends, I think, to the debt will continue to rise, but people will be looking for repayment help in lieu of scholarship assistance. I think that we're going to see an increasing number of families having to get creative with ways to where they can fund college. A lot of families come to me, they say, hey, we don't like a lot of these interest rates. Can we do something that's a little bit cheaper? I think that earnings potential, regardless of what some organizations might see, I see earnings potential as a big driver in terms of specialty. I see that almost every day now. A person will come to me and they'll say, hey, yeah, I like the idea of, family medicine, but I'm going to leave family medicine. I'm going to work at a urgent care clinic because I can work less but make more. Trying to find that work-life balance. And also people who, as they're looking to match or go into training, they want to search for those programs that are shorter so they can get into the workforce faster. And so we're starting to see a lot of this starting to bubble up, and the debt is, of course, a driving factor. Now, what's been going on lately, as I'm sure some of you have been paying attention to, there's been a lot of activity this year congressionally, of course, because of COVID. So in March, we had the suspension of interest rates for all federal loans. So if you're on this webinar and you had a federal loan, or listening and you had a federal loan, your loans have been at 0% since March 13th. And they'll continue to be 0% through the end of this month. The CARES Act, which was signed into law back in March, and then subsequent executive orders have kept the interest rates low and have paused payments for this period of time as well. Now, the big provisions of the CARES Act as they pertain to a lot of people in medicine was that these payments, even though you weren't required to make the payments, these missed payments actually still counted towards things such as public service loan forgiveness. And so that's what they're talking about with consideration of payments. So people were not making payments, but they were still getting credit towards public service loan forgiveness. So public service loan forgiveness is that program where they talk about, hey, you pay for 120 payments, your loans are forgiven tax-free after 120 payments. Well, if you're not making a payment, then you're not earning credit towards that forgiveness. And so because of that, people were nervous that their time away from making payments was actually going to delay the possibility of forgiveness earlier. So with public service loan forgiveness, there's a few things that people have to keep in mind. You have to be working at least 30 hours a week, which is that magic number. So everyone talks about full time. Well, 30 hours a week and be considered full time by their employer. If you're working multiple jobs part time, as long as it equals that 30 hours a week, you're still earning credit towards forgiveness. You must have loans in repayment. So this pause on payments and this consideration of payments didn't help interns who graduated in June because they didn't have to go into repayment. So anybody who graduated from medical school in June of 2020, they earned no credit for public service loan forgiveness even during the CARES Act because they weren't required to be in repayment because of their 6-month grace period. And the idea of also working for a qualifying employer. So that qualifying employer being a 501c3, state, county employer, etc. Now, of course, it can be different. You have to be actually a direct employee of that employer, which changes from state to state about how they quantify that. But if you work for a group that contracted through an eligible employer, that doesn't qualify. You have to actually be a direct employee of that employer. So if you were a resident at UT Southwest, you'd qualify. So quick recap. Public service loan forgiveness, it's still around. There's talk about, is it going away? I heard it's being discontinued, all these other things. Like, no, it's still around. I don't think either political party wants to get rid of the program. In fact, they've expanded it under the current administration about how many people can actually qualify for it. So you have to work for that qualifying employer. It's 100% tax-free. Must have qualifying loans, which are direct loans. When you hear these statistics about people being denied forgiveness on this program, it's because they're, the vast majority of them, they didn't have the right type of loans or they went in repayment for the right period of time. Also, this note about consolidation is your enemy. Consolidation, and what that means is that if at any time during your repayment program, you decided to consolidate or push all your federal loans together into a new loan, then any repayment history you had before then is erased. And you actually would have lost time by consolidating. So if you're an intern, if you're in residency, or heck, if you're intending in practice right now, if you've been looking at this program, I'll tell you this, don't consolidate if you still have federal loans. Because consolidation erases everything you did in the past and starts everything brand new going forward. So again, neither party wants to get rid of this. It's been through 4 different administrations. Bush administration signed it into law. The Obama administration managed repayments for the first 8 years. Trump administration was the administration in charge of handling the first period of forgiveness, and the Biden administration will be continuing the forgiveness after that. Now, of course, you can imagine the handoff between each and every administration has been a little bit different. And that's why I think we have so much misinformation. I would actually, I've really applauded what's happened the last few years. In fact, that they've created additional websites and web help tools to allow a person to actually log into their account with the federal government and actually run an automated audit of their loans to see if they are actually eligible for forgiveness or not. Now, this is something that some employers don't think about. Some employers will think, okay, well, their servicer is helping them with this, or maybe their financial advisor is helping them with this, or maybe their school's helping them with this. We don't have a role to play in this. Well, that's incorrect. The employer has to sign off on what is known as the employer certification form, which is that last bullet point down there. They're the ones who have to attest to the fact that that individual is actually working at that location in an eligible capacity. Then that employer is part of that forgiveness process, because now the employer is saying, yeah, hey, we're saying that Joe or Sally, whomever, they're an eligible employee, we're an eligible employer, we're essentially sponsoring their forgiveness, for lack of a better term. And what I don't think a lot of employers understand is the number of employees they would have on staff that actually could qualify for these programs, and how much of a benefit these programs provide their employees. And one thing I bring up when I talk to some employers is, okay, what is your public service loan forgiveness contingency plan? Meaning, what happens if you went from being an eligible institution and then bought out by an ineligible institution? Now, all of a sudden, all the employees that you had working for you are no longer eligible for this program that would have forgiven their debt tax-free. So how is it that you as an organization are going to help these employees handle that debt going forward? And this is why I've seen people leave positions, because they no longer work for an eligible organization. So in terms of the numbers, as this is always talked about, this program is becoming, I wouldn't say more popular, I'd say it's become better known. And when you look at ineligible employer certification forms, the number one reason why these forms are part of that audit trail, for an employee to actually get forgiveness, they have to be part of this audit trail. Employer certification forms are the number one part of this trail. Missing information. It's not that you're dealing with people who are ineligible, they're just not filling out the form completely. 4% of people are rejected because they don't work for an eligible organization. So this is people who hear the stories about people who don't get forgiveness and they thought that forgiveness was due. Well, they never did the audit trail and they waited too long to find out that they didn't qualify. When we look at the actual forgiveness that's happening, the number one reason why people are not getting forgiveness is the fact they haven't made the right number of payments. All right, so it's not that the program is broken. It's the fact that the people haven't been on the payment program long enough, or they haven't been on the right payment program for the right amount of time. No eligible loans, and then the forms are missing information. So again, these are people who have almost gone to that 10-year mark and then applied for forgiveness, not knowing whether or not they're going to be eligible. I've actually ran into many attendings who have been in practice for years, they still had loans, and they had no idea that they were actually eligible for these programs based on their position. They always had this idea that, they didn't have the right type of specialty, or they're in the wrong department, or, based on how their job is paid, they're part VA, they're part this. It can be really simplified, and some people, they overcomplicate it. And this is one of these programs that blankets everyone. This is a national program for people who have federal loans. So public service loan forgiveness, again, is tax-free. Versus a discharge of indebtedness that's provided by pay-as-you-earn, Repay, or IBR, that's taxable. And each qualifying payment is a step towards forgiveness or discharge. So of course we hear a lot of the talk on the news now about people discharging debt, etc. Well, honestly, there's already millions of Americans on the path towards discharge because they're part of one of these 3 repayment programs right here. Their loans will be discharged in the future eventually. They just have to make payments for 20 to 25 years. Now, what's going on now as the CARES Act ended October 1st, the executive orders signed by President Trump carried a lot of these provisions through the end of December. And then starting in January, we're going to be in this new era of, okay, what's next? And so there's been a few things that have been proposed. The Senate HEALS Act, there was no extensions for anything. In fact, the HEALS Act didn't touch loans at all. So the way I'm looking at it right now is that I'm expecting everyone to go back into repayment in January, regardless. Anyone who has a federal loan, you're going to start making payments in January. I don't see anything happening before then. Afterwards, though, it's possible that something such as the HEROES Act might take hold. And what's interesting about this is the fact that they had a provision in there that would allow for people who work for a group. So if you work for a physician's group, but your group rendered services at an eligible employer, then the physicians of that group would qualify for public service loan forgiveness. And I find that to be very fascinating. It would almost be like if you worked at you worked in an anesthesiology group, and your group primarily worked with, say, I'm going to keep bringing up UT Southwest, which is an eligible employer. Then all of a sudden, your anesthesiologist in that anesthesiology group would be eligible for public service loan forgiveness because they rendered services at an eligible employer. I found that to be fascinating. And if they did that, now they're talking about expanding forgiveness to a broad swath of people, and also expanding the number of people that can actually get it, and allow people to accumulate that time faster. So what I kind of expect happening is I do not expect a forgiveness of all outstanding debt. In fact, if they tried to discharge all debt, all that discharged debt would be considered taxable income. And so I can't imagine President-elect Biden getting up there and just signing off a broad swath of debt, because that would just hurt a lot of people tax-wise right away. Also very counterproductive. I do expect them to extend the zero interest and zero payments. Even in our politically charged environment that we have today, when President Trump paused interest in payments way back in March, no one on either side of the aisle said a peep. They're like, okay, good, we like that. When he extended it after the CARES Act, no pushback from anyone at all. One thing that I've noticed when I look at past legislation and proposed legislation is that there's always bipartisan support for anything having to do with interest rates. And when you play with interest rates, they say, hey, that's easy. Zero interest for loans, that helps people. It helps people a lot. I have clients that have $300,000, $400,000, $500,000 of debt. This zero interest rate period has saved them $30,000, a lot more than a one-time stroke of the pen, $10,000 discharge would help them. So I can see zero interest going forward. I also expect some targeted discharge. And what I mean by targeted discharge, I mean that they're looking at specific groups of borrowers. And they'll probably have it for teachers, specific public servants, etc. And I don't expect any long-term fixes. So in summary, we're looking at things that will help out lower income individuals. I think they will continue to do something. I just don't expect any sort of full discharge, but I do expect an expansion of repayment programs. So loan repayment. This is where people get really confused, and this is why I think there's a lot of confusion surrounding public service loan forgiveness, state loan repayment programs, etc. There are 3 types of federal repayment programs that are out there. You have your standard plan, which is what everyone enters into. If you get kicked off a income-driven repayment plan, you go into the standard plan, which is the 10-year plan. This is the default repayment plan for all federal loans. You have the extended plan, which is only for borrowers who have $25,000 or, I'm sorry, correction, $30,000 or more of direct federal loans. Then you have income-driven plans, which are right in the middle. They are less than or equal to the standard plan, with one exception, and they do not go longer than the extended plan. So how an income-driven repayment plan works is the fact that your payments are tied to your income. We've been doing this, I believe, since 2012. This is not a new idea, even though they keep bringing this up as it is a new idea. No, we've been doing this for a while. And these plans, after you've made your payments for 20 or 25 years, anything you have remaining is then discharged. So they're asking you to make a payment, and then after you've made your payments, your loans are gone. Taxable, but they're gone. So there are a few drawbacks in the fact that these income-driven plans typically do not keep up with interest. I tell a lot of my resident clients that, hey, your biggest cost during residency is going to be that interest accumulation that happens in the background, but there's not much you can do about that. You have capitalization, which is when that interest adds to your principal balance. So you think about, you don't pay off a credit card, the credit card balance grows. Well, with federal loans, the principal balance, the balance of the loan actually doesn't grow until you make a change to your program. So you have your principal balance and then it's kicking off interest in the background. That interest doesn't add to the principal, doesn't grow the size of the loan unless you make a change. That's considered capitalization. Repayment plans, they call it the marriage penalty because your spouse, which is never party to the loan legally, their income is actually part of the repayment equation. The maintenance, which is you have to do annual maintenance to stay in the good graces of the Department of Education for your repayment program. It's not a fire and forget type of strategy. No, you actually have to pay attention every single year to make sure you stay on your program. Then you have to worry about the taxes on discharge. So there are 5 main programs that are out there. Income-based repayment 1, income-based repayment 2, pay, repay, and ICR. No one ever uses ICR. I've counseled thousands of people. I have yet to suggest income contingent repayment. So we won't waste time on this one. Income-based repayment 2 is no better than pay as you earn. So why they created another one, I have no idea. So what we're going to focus on is income-based repayment, pay as you earn, and repay. So to get super technical, these are income-driven repayment plans. They're not income-based plans or income-driven repayment plans. This is one of the reasons why I think people get confused, is that you hear a person talk about repayment plans. They refer to all these plans as income-based plans, when in all actuality, income-based is one of the 5 different income-driven plans. And sorry to really hit on that point, maybe a little bit too much than what I had to, but it's important because especially if you're a borrower talking to your servicer, and they ask you, what plan do you want to be on? And you tell them, hey, I want to be on an income-based plan, they'll sign you up for income-based, which is the most expensive of the plans. So income-based. This payment is eligible for all federal loans. If you have older FFEL loans or federal direct loans, income-based repayment is like this umbrella repayment plan that it covers everything. I can literally talk to a person, ask them, do you have federal loans? If they said yes, I can say, all right, sign up for income-based repayment because everyone's eligible. And you can go in front of a room of 1,000 people, all student loan borrowers, and tell them to sign up for income-based, and they would all be eligible because there are no limitations placed on who can sign up for it. There's no limitations based on the type of loans. There's no limitations based on when they borrowed. Anyone under the sun can sign up for this program. The reason why not everyone should is the fact that it is the most expensive of the programs. It's 15% of discretionary income. We'll get into that math a little bit later. It goes for 25 years. And it will end up costing you a lot more out of pocket than the others. The second one is pay as you earn. Now, pay as you earn is only eligible for people who did not borrow before 2007 and borrowed after 2011. So essentially anyone who's been in medical school for the last decade. It's 10% of discretionary income and only goes for 20 years. And the payments cap out at what your income-based repayment plan or what your standard plan would be on. This is one thing that's also a misconception, is the fact that you can get kicked off a repayment plan because you make too much money. This is what I hear a lot of people tell me as they're looking at refinancing their loans with a private entity. They'll look at me and they'll say, well, you know, Justin, I'm going to make too much money as a physician. I'll get kicked off these programs. So why should I even try? Well, that's not correct. You don't get kicked off a program because you make too much money. You can be denied re-entry into a program because you make too much money. But if you signed up as a resident, or heck, even in some cases as an attending, you will not get kicked off unless you decide to leave. And this plan also takes into account your spouse's income, just like income-based repayment. It does allow you to do married filing separately, which will remove a spouse's income from the equation. So this is when I have situations where I have two married physicians or two married professionals that both have student loans. How do you come up with the best cash flow situation for them? Sometimes you have to look at married filing separately. Sometimes it's married filing jointly. It always goes back and forth. Now, Repay is the newest one. Its payment is similar to pay as you earn. In fact, it's 10% of discretionary income. However, it will always include a spouse's income. And there's no cap to how big the payment can get. And that's something that catches some people off guard, is that they'll hear this great stuff about, hey, Repay is a new payment program that everyone should be on, but yet they don't take into account that if they're married, their spouse's income must be included in the equation. It's a 25-year plan, and there's no cap to how big the payments can get. So this is that one exception to a cap on payments, the fact that if you were on pay as you earn and you decided to go on Repay, well, then your payments can get astronomically high as you make more money. Again, you don't get kicked off because you make too much. No, they'll happily take everything you will give them. The one neat feature of Repay is the fact that it has a provision that discharges tax-free 50% of a borrower's unpaid interest. So this is where a federal program actually has a provision in it to where if your payments are not able to keep up with your interest, we'll give you half off. So again, another example of what they're already doing for people who are borrowers in terms of interest rates. So the math is pretty simple. They take a look at your adjusted gross income. So I believe line 7 from your 1040. They'll subtract from that 150% of the poverty guideline for your household size. That's what they consider your discretionary income. Multiply that number by 10 or 15%, divide by 12, and that's your payment. So as adjusted gross income goes up or down, so too does your payments. And this is where I look at people who are on these federal programs. I'll say, you know what? If your employer offers retirement plans, you should really take advantage of those plans because those plans actually help you with repayment. And then you explain to them, like, listen, if you contribute more money into your 401k, your 403b, your 457, your 401a, anything you do pre-tax reduces your adjusted gross income, which then in turn reduces your loan payment. You are actually getting that benefit, an additional benefit to that retirement plan that you weren't even thinking about, which is loans. And there's talk about allowing more employers to provide loan repayment assistance, similar to what they do at Abbott Labs, which Abbott Labs, they give a employer, so their employer matching contribution is used as a payment towards a person's loans. And again, I can see that becoming more widespread as more and more people look for employers to provide help with repayment. So again, here's a similar situation where we added 10% to retirement pre-tax, and we see that the take-home pay did not change very much. So take-home pay $5,953. So these working cash flows, you put additional money towards retirement, your working cash flows aren't actually reduced as much because of the effect and the reduction on your income-driven repayment plan and on your taxes. So one thing I always tell people, and when I talk to employers about what else they can do, what else they can provide, I'm like, well, hey, increasing the number of retirement plans you have available to your to your employees, that'll help out a lot. And for employees, if you have retirement plans available to you, use them because they also help with repayment. Other options that are out there are one that we discussed earlier and one that I've alluded to a little bit. So you have consolidation and refinance. And consolidation is a federal process. This is you taking your federal loans and pushing them together into one new federal loan. You do nothing beneficial mathematically when you consolidate. The only thing that you do when you consolidate is that you have one or two loans after consolidation. Your balance doesn't go down and your interest rate actually goes up. Also, what is bad by consolidation is that if you are trying to utilize a state repayment program that only repays loans for medical school or dental school or whatever for medical professional training, and if you consolidated ineligible debt with eligible debt, that new loan can be considered ineligible for all repayment help. So just by consolidating, which you think, hey, I'm making my situation easier, you've actually reduced your repayment options. I believe only the Indian Health Service Corps breaks out a consolidation loan to see how much of that debt was actually attributed to medical education. A refinance is similar to a consolidation, but it's through a private party. SoFi, Laurel Road, Evervest, Link Capital, Common Bond. There's a whole bunch of companies out there right now that will pay off your federal loans for the promise that you'll pay them back. Now, you usually get a lower interest rate, but you lose all federal protections. So everything they're talking about now in terms of discharge, zero interest, forgiveness provisions, etc., that's only for federal loans. As soon as you refinance, you're essentially saying, I do not want to worry about any of that. I want to just get a lower interest rate. What I'm telling all my clients is that you wait to refinance after you find out what the new administration is actually going to do. Because the only thing they're talking about is helping federal borrowers. People who have private loans are not getting any assistance at all based on any of the provisions from any of the bills that I've read. The only caveat to that is, I believe, Senator Maloney, she had a proposal, she's out of New York, she had a proposal to forgive debt for all frontline healthcare workers, private or federal. Again, that's like a big promise that I don't see coming to fruition. But that's one instance where I've actually seen legislation that wanted to do something with all debt. So the issue with refinance is that when you do a refinance, you have to take a look at your break-even point. And this is what I'm always doing whenever I'm doing a calculation for an individual who's looking at what's their best repayment scenario. I'm looking at total cost out of pocket. It's easy to focus on interest rates, but based on how the federal repayment systems work and what's available out there in terms of repayment assistance from federal or state institutions, I like to take a look at all options on the table and say, okay, well, this is our total cost if you refinance, your total cost is going to be all the payments you made before you refinance, plus all your payments that you make after refinance. And is that greater than or less than what you can expect to pay if you didn't refinance? And some people they don't do that math. They'll be in on a federal repayment program for 10 years, have 10 years left if they had switched to, if they stayed on pay as you earn, or if they went through another organization, and then they decide that, hey, I want to refinance now. Okay, well, now you're starting from it. You have your 10 years you've already made payments for. Now you have another 10 years or whatever it is that you might have signed up for. So refinance is popular in some cases, but I don't think people really take a look at the entire cost. So during this period of zero interest, zero payments during the CARES Act, anyone who refinanced, they still had to make payments and they still paid interest. So when I look at all this from an employer standpoint, I always want to know, how active is the employer in tracking who or how many of their employees is actually using public service loan forgiveness or a third-party repayment program? Do you know what is being used? Do you know how many people are on it? Do you know how much it will cost you if they left? Do you know how much it will cost potentially if an institution no longer provided forgiveness? Are you looking at any of this? Are you making sure that people are actually filling out that employer certification form properly? Now, this is something that I ran into a lot, where you go to an institution, they have 5 different people filling out the form 5 different ways. They want to know, okay, what's the harm in that? Well, the harm is this: the Department of Education is using that form to forgive hundreds of thousands of dollars of debt. If they come back and they do an audit and they say, well, your institution was actually filling this out incorrectly, and that employee was actually working less hours than what you said, let's have a conversation about how you're going to pay us back. And so when employers say, well, hey, this is not something we need to worry about. Oh no, you need to worry about this a lot. Because again, this is your HR confirming the number of hours that are being worked by these employees that then makes them eligible for forgiveness. If those hours are misstated and it comes back and it's found that that was done incorrectly, that doesn't go over very well. So I always make it a big point when I'm talking to institution, you need to make sure you have a process in place for everyone who's trying to use this program. Because do you want to be on the receiving end of the Department of Education if they come back and say, well, hey, we've forgiven 100 different employees from your organization, based on the amount of debt we've forgiven, we want to do an audit, which they have the right to do. Because you, the organization, signed off on that form. And what I usually find is that you'll have an administrative assistant, or you'll have anyone other than HR filling that out. I've actually, when I was at OHSU, I had one of the vice provosts was asked to fill out the form, and they weren't even sure what the heck it was, because no one knew where to send these forms. And so we had to create a process. Now, there's also one out there. There's a new program called the Temporary Expanded Public Service Loan Forgiveness. This is for people who were paying on the incorrect repayment plan, but had otherwise eligible loans. And this is where I find a lot of practicing attendings fall into this category, where they've been on the, oh gosh, they had their 1% loan or they had a 2% loan, and they decided to go on the 25-year plan, which again, you have a cheap loan. You don't pay it off quickly because your money can be invested better elsewhere. That's the whole idea, of course, of taking a longer period of time to pay off a low interest loan. Makes complete financial sense. However, what's interesting about this is that if you had signed up for that extended or that 25, 30-year plan, and you had federal loans, which I've ran into attendings that had consolidated their loans into a direct federal loan like over a decade ago, they can then apply for forgiveness because they had the right type of loans. And the simple fact that they were on the wrong type of repayment plan doesn't make them wholly ineligible. It just means that they have to go through a few extra steps to actually get that forgiveness. And so it's completely possible for forgiveness, even for people who have been practicing for years. And here's a real quick case study about potential out-of-pocket costs when on an income-driven repayment plan. And you look on it, when a person has $125,000 of income, federal debt of $300,000, which I'm starting to see a lot more of. Actually, I see a lot of $400,000 and $500,000 estimated out of pocket. Notice how it doesn't change because the income-based repayment is based on income, not on debt size. What changes is the amount that's discharged. So the discharge actually goes up, and so this is all taxable. Then I compare that to a refinance, what is cheaper. And the last program that's out there is for a lot of people who are in allied health. So people who are PAs, dietitian, nursing, therapy, etc. Anyone who's considered part of allied health, if they had borrowed a Perkins loan, then their loans could be discharged after working for 5 years. And this is something I run into again when I'm talking to institutions. I'll say, okay, how many nurses do you have working here? Oh, we have a few hundred. Great. Who's paying attention to who handles the Perkins loans? And they kind of look at me with like this confused look. And like, well, Perkins loans, if you have practitioners, do they know that these loans that they have can actually be discharged just by working, or if they're PAs? So you look at it within a hospital system, there are a lot of different opportunities or avenues that they can go down that doesn't cost the institution any money to actually help their practitioners find forgiveness or ways of paying off their debt quicker. And so that's the end. I know I went through that very quickly. That's almost a cliff notes of everything that's out there. But any questions, happily answer.
Yeah, one kind of administrative question. Will they have access to the slides? Chris will send those out. So people that enrolled and are participating, you will get copies of the slides. We have a couple of questions. Is public service loan forgiveness only available to primary care providers?
No, that's a common misconception that it's only for people in primary care. It's actually anyone who has a federal loan, who's on the right repayment plan, who works for the right type of employer. Your position in the employer is irrelevant. It's only your loans, your repayment plan, and the type of employer that you work for that are relevant. So this is where some people, they leave the program early because they don't think they're going into the right type of occupation.
Good point. Here's another question. The PSLF has only worked for about 1% of the total applications. If that's the case, what needs to be fixed for it to be more usable?
Great question. So I think what needs to be fixed is what they're actually trying to address right now. There's a lot of misinformation out there. Again, we look at the number of people who were denied. The biggest part of the reason why people were denied is the fact they didn't make the correct number of qualifying payments. So they weren't on a repayment plan the entire time, or they had missed the payments. I ran into people who have missed payments in the past and their number of payments are behind, or people had made extra payments. So one thing that can hurt you is if you make a bigger payment than what's asked of you. So if your payment is $500 and you decide to pay $1,000, a servicer will actually reduce your payments for the next month. So they don't take that extra $500 that you paid them and put it towards your loan balance. No, they apply that to next month's payment. Well, if you didn't make next month's payments, you don't get credit for that month. So you get one credit for, say, January, where you made your $1,000 payment. But because you paid more than what you were supposed to, they gave you February for free. Therefore, you have an additional, you missed out on a payment just because you're trying to pay off your debt faster. Servicers, and the reason why every servicer has been fired, so the Department of Education has fired all servicers, and as of March of 2021, there will only be 2 entities handling loan repayment. It's because of all this misinformation. So I think it's great that they're trying to consolidate the number of people who are providing the information. However, you still have the same number of providers, you just have less people helping them.
Right. Here's another question. Will the servicer be able to direct and guide loan borrowers to get on the PSLF if asked? Can the servicer, in other words, help advise?
They're supposed to, but the reason why we're in the mess that we are in today is the fact that servicers, they're not on the same page. And so they can tell a person, hey, yeah, you can be on this repayment program, but we can't tell you if it's the right one long term. And a lot of times they don't understand that, hey, these programs are not, they'll tell you, oh, you're a physician or you're this or you're that, you make too much money, you're not eligible. They don't look at a bigger picture. They read from a screen. They have a script that they have to go by. And if your questions or your situation doesn't fit into that script, don't expect for your answer to get, don't expect for your question to be answered.
Here's another question. If I have a student loan, should I only be making minimum payments until we find out about the loan amounts and if they'll be discharged, or should I continue to make additional payments to pay off that loan?
My advice is to not make the additional payments, or at least don't make additional monthly payments, simply because the servicer will not put that payment, that additional payment, towards your principal or interest unless you specifically tell them. And if you don't specifically tell them every time you pay more, don't expect for your balances to go down. I usually tell my clients to make extra payments annually or quarterly so they don't have to write those payments, or they don't have to write that letter over and over and over again. In fact, the Consumer Financial Protection Bureau, the CFPB, back in 2013, they created a form letter to address this exact same issue. So we've had this issue for almost a decade. They haven't fixed it yet. So I'm telling people to make minimum payments to see what happens on the federal level. And then after we find out what happens then yes, make extra payments, but make them either quarterly or annually, just so you don't have to run into any issues with them. They reduce next month's payment because you paid too much. Like, no, you want them to actually pay down your debt, not reduce your future payments.
Another question, will any of the repayment plans be acceptable in the goal of the PSLF, or which one do borrowers utilize to be able to ensure they get the PSLF?
Great question. So any of these income-driven repayment plans are eligible plans for public service loan forgiveness. You have to be on an income-driven plan to be eligible for public service loan forgiveness. The exception is the temporarily expanded public service loan forgiveness, which they allow people to apply for if they were on the extended plan. So any of these plans qualify as a qualifying plan for public service loan forgiveness. The extended payment plan can work for forgiveness, but only if you apply for the expanded public service loan forgiveness program.
Here's another question. In your opinion, what really needs to be done to the student loan crisis to fix it? That's kind of an open-ended question.
Oh, yeah. I actually write about this quite often. In my opinion, the fixes have to be, they have to look at tax changes, make it easier for people to actually receive tax benefits for paying on student debt, allow for employers to pay on employee student loan debt without negative tax impacts. So allow everyone to be part of the solution. They have to reduce the interest rates. I think that would help out a lot of borrowers. They also have to go to the institutions which provide no guidance for the borrowers and be upfront with them about the actual costs of their academic programs. When I talk to other financial planners about this as they're preparing their clients' kids or whomever for college, I'll talk about, hey, that piece of paper they walk out with will cost the same regardless of the program they studied. So what's the economic impact of that program that they studied? So there has to be a lot of misinformation that needs to be corrected. A whole like just wipe clean of all debt or free everything like that's not sustainable. Not even close. But things that are sustainable are tax changes, interest rate changes, and allowing more people to be part of the solution. That would help out a lot. And just one last thing, you can do something called a qualifying gift when a person's going to college. I can pay for a person's entire college education, and it doesn't go against my lifetime gift tax exclusionary amount. However, I cannot help out a person pay off their student loans because that would go against my lifetime exclusionary amount. So there are tax law changes that can be enacted that actually bring a lot more people into the actual solution versus just, again, forgive everything and then we start over again. People are not going to stop going to school, and universities are not going to reduce their tuition rates. So, but there are things that can be done. And of course, I have more to say about that, but I want to be conscientious of time.
Well, Justin, I think you'll want this last question that just came up, and I think I know part of the answer. If we have multiple loans, who can we go to for advice on how to handle these loans? Is it okay if we contact you and your service? And then they said, how much will it cost? But Chris is going to send and ensure that everybody on here has your contact information, Justin, and I'm sure you'll be delighted to answer any person's question if they contact you.
That is correct. And yeah, more than happy to work with anybody individually if they so desire. We work with both people and institutions to help them address this issue.
Well, Justin, that's kind of the end of the questions. You've done an excellent job. Do you have any closing comments for our participants?
I would say my closing comment would be, when you're looking at a debt situation, it's going to be the answer is going to be a lot more in depth than just looking for a low interest rate, because of all the ways that dominoes can fall and based on how a person's career might change over time. Sometimes the easiest solution or the simplest solution isn't the best one. And so always pause. If anyone ever says, oh, just do this and you'll be fine, always take a step back and think, okay, when is that ever true? There's always a lot of time and thought that goes into this. And so I would always tell people, I would recommend that people take that time and put in that thought.
Well, on behalf of all the people that are on this webinar, we want to thank you, Justin. Excellent presentation, a very robust Q&A, and we thank you for this. And I know on one of the slides it's got your email and number, but Chris will send that out again also just to ensure everyone has it. But Justin, thank you very much.
You're very welcome. Thank you, Steve. Thank you, Chris. I appreciate everyone's time today. Be safe, everybody, and happy holidays.
Same to you.